¿Ya estamos en? So hello everybody. So thank you for joining us. Today we have a nice case. Just a few days ago, I had the pleasure to make a presentation about this technique. It's called CBOM. So this patient have this is the esophagus. You see. So I can go down. This patient have a big reflux disease. You can see a lot of intrapapillary loops with the OE system from Pentax Medical. Thank you again for supporting me. Donna, thank you. So this patient have a Barrett's esophagus also. You can see here very well. So and this is the stomach, okay? You can see very well. And now, so I will remove a little bit, because I want to see exactly in the point where is the septum. This is very important to understand because this is the area where you will go to make your treatment, okay? So this is very important, right? So now I am very near to the muscle and the Senker diverticulum. You can see here, this is the esophagus again. I believe this is part of the Senker. Here, you see, here is the point where I will start my treatment. Because you see, so this is the septum, right? Very well. Esophagus is up. Down is the diverticulum, and here I need to make my dissection. I really love this technique because to me it's very difficult to identify where is the limit when we have to cut by the conventional technique. And nowadays, my good friend Mowen Kashab, he described the open Z poem, which I need to understand a little bit more. His technique, I believe, is very interesting, but I prefer continue to do it the same technique because I believe it's a little bit more short. So we need more data about this, about the data from John Hopkins and Professor Kashab. Well, my assistant here is asking me if I measured the fundus of the diverticulum. I didn't do it. So this part is very important. You can see here, there is some mucosa area that we need to evaluate very well. I will take some biopsies just in a second time when this patient needs to come back. So it's almost 2 centimeters, 20 centimeters. The diverticulum is big, right? So now I will start doing here my poem. Okay, I will start to inject. I will use a microtech needle. I like this needle because it's just 3 millimeters, so you can go directly to the submucosal in an easier way. And I like to use Blue Boost from them. Is the hyaluronic acid that we have here in the country. I believe is the only one for the moment. Open. Momento, cierra. No, cierra, dije. I need to be very sure. Okay, so here. Abre. Inyecta. Sí, sigue. Okay, retira. Okay, so now I do my submucosal injection, and now I will start to make my dissection here, and I need to go in both way, right? So when we are doing CPOM, we need to go in both way. We need to go through the esophagus, and then you need to go through the other way, right, to make a dissection and to cut, right? So we will start doing the dissection. I know that 20 centimeter I need to go, right? It's a big diverticulum, no? So I will use now a flush knife from Fujifilm. Fuji, right? I like this device because it's a small device. It's easier to use. You can inject. You can make a lot of things. And I also like to use sprite coagulation when I am using my tunnel. I believe I go faster. But well, abre. Sí. ¿Puedes bajarme un poquito la cámara? No, la cámara. Un poquito más, porque no alcanzo a ver el monitor. I'm sorry, I have technical difficulties because of Brian. Brian is not helping me. So now... Ok, ahí está mejor. Perfecto, ahora sí. So now I can see. Ya está. Gracias. It's very important that you have a very good control of your vision, because if you don't have control of your vision, you can make a mistake, right? So this is the other thing that is very important. Now I will try to cut a little bit more. And the cut I try to make in the same way of my septum, right? This is another very important step when you are doing Z-poem, the standard technique. I need to learn the open Z-poem, and I will give you my feedback once I start to do it. So now I open very well, and now I will start to try to get inside, because I want to get inside, right? And I use the water. I will show you why to use the water, because water, it helps you to get inside easier. Let's see again. You see, it's big, huh? It's very big. Yo sé que estamos afuera, está dentro de la... So now it's here. Okay, so now we are again here. So now I am trying to dissect a little bit the submucosal space, because I want to go inside. I am almost inside. It's very important to understand where you are. Okay, so now I am inside the tunnel, you see? Very well. Now I will change to sprite coagulation. I use 3.3 from the Hervé Vio 3, right? So I start to make the dissection. You can see very well. And we go faster. I like it because I can burn and I at the same time I can, you see, make a good coagulation, and I don't need to change too much my to use another device like Coagrasper. Sometimes you need to use it, but at least I believe we can go faster with this, right? You see here very well. So now I'm starting. Very good. I will try to see a little bit where I am. We'll dissect a little bit this. Okay. Some kind of fibrosis I see here, but this is normal. Sometimes it's because the food impactation make this situation, right? So we need to be very clear. I will get out a little bit. I want to see where I am. So you can see I was going inside, I believe, the diverticulum, right? I believe. No, 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 no. This is the esophagus. Huh? This is the esophagus. Huh? Okay, it's a vessel here. Now I open. You see? You need to go very slowly. To see where is the space and where you need to cut, where you need to dissect. sometimes I believe it's little bit easier than today. I don't know why, but well, it's okay. Huh? It's part of the work. Okay. You see, it's very tight, huh? But once you get very well, you can dissect better. So this is the line where we need to dissect. You see? Mira esto. Okay. Now we need to dissect here up a little bit. a lot of fibrosis here. I need to dissect very well this fibrotic area, because if not I will have problems when I will close. Let me see where I am. I want to see, because I make a small hole there, so I want to see exactly where I am and where I make my hole. I need to see where I make my hole. Okay, I did a hole, a small hole. I think it's in the diverticulum lumen, right? Yes, it's here. You see? So I dissect the whole part of the diverticulum now. I need to close this with a small clip. Dame un clip pequeño. Yes, I will use one 8mm clip. This clip is from Microtech, correct? So once I close here, I know that I did my whole abre. Very good. And now cierra. So I believe I have it. Close, cierra. Okay, perfect. So now I close very well. So there is a question from Dr. Juan Manuel. He's asking what? ¿Qué estás preguntando, hijo? Ah, he is asking me why I didn't close from the inside to outside, because I believe it's better. I needed to have an idea where I was. So this is the tunnel for the diverticulum. This up is the esophagus here. So that's why I wanted to see where I was, because sometimes you can be lost, huh? I'm not perfect. I'm not Professor Kashab. I'm just a human. A standard endoscopist. Okay, so here. Let's try to get this part up. I believe. He's asking if this is a septum. I don't know. I'm not so sure. I believe yes. See? tricky, but it's okay. Now I need to dissect this part, the upper part, okay? And I need to go inside. So now you can see the esophagus, the muscle. I need to dissect better here to get inside. No easy. It's not easy. Trying to get inside. You see? So now I am using the water of my endoscopy channel. So the the water jet from the endoscope, I'm sorry, and not from the needle knife, right? Well, in this case the flush knife. I'm sorry, today I'm a little confused sometimes, but it's okay. Now I'm okay. I believe it's here. I need just more 2 centimeters, but it's not so easy, huh? It's very stick, very stick. Now I am starting to open very well. Now I am opening, right? So I need to cut up. Very difficult. ¿Cómo? Se- yes. I'm not in a perfect, area because I am cutting the muscle, to be honest. I am just a little bit more to cut, but I want to dissect this area. This is a problem. I didn't achieve to dissect very well. When these things happens, so you have two ways, right? One, try to insist by this way. The second one is trying to inject outside and get in, right? So I will try to do this because I cannot see very well and I don't want to make a big damage in the mucosa. This is my tunnel, which is good. This is the verticulum, and this is my tunnel, and this is the esophagus, right? So now I will inject here. So this is just a small tip that I can do it for you. You need to calculate a little bit more, so I will go in this area. I'm going 20. So my diverticulum is until 20 centimeters, right? So I am going a little bit down to 24 now, and I will inject. So in that way I can make a separation, because this patient have a big reflux disease, so this is an inflammation. There's a lot of intrapapillary loops. I show it a little bit when I was doing my endoscopy, right? So now I will try to do this way. This is the Alberto Batista technique. Inject outside, right? Abre. And I like it. I think it's very useful. Inyecta. Momento. Inyecta. Ok, sigue. Para. Momento, retira un poquito. Inyecta. Para, retira. Abre. Inyecta. Sigue. Para, retira. Abre. You see, there is not a lot of cushion. Inyecta. Para, retira. Abre. Inyecta. Sigue. Todo. Para, retira. Abre. Inyecta. Para, retira. Abre. Inyecta. Momento. Estás afuera. Inyecta. Sigue. Para, retira. Abre. Inyecta. Sigue. Para, retira. Abre. Inyecta. Sigue. Para, retira. Retira. So you see, now I'm injecting more. Abre. It's better in this way. Inyecta. Sigue. Para, retira. Okay, now let's see where we are now. Let's see where we are. So it's just here in this way, you see. So I believe here we need to inject a little bit. Abre. Inyecta. Sigue. You see? So when it's very hard, because it's stick, the submucosal, it's better to use hyaluronic acid. I prefer to do it. Inyecta todo. Sí. No, está bien. Guarda, guarda. Okay, listo. So now I can go in this way. And I cannot, I will avoid to cut the muscle now. You see? Now it's better. Okay. It's first sign that it passed to me this, huh? Because this patient have reflux disease. That's why this patient was not diagnosed initially, I believe, because it was treated as just a reflux disease because of the guidelines. That's why guidelines sometimes is not so good. It's good sometimes, it's not good sometimes. Okay, abre. Now you see very well. Now I am going inside. Not easy. I think it's here. It's good now. Now it's good. You see? So I help myself using the blue boost, the hyaluronic acid, in the upper part because I was cutting the muscle. So it was not perfect and it was sticky, right? Because of inflammation. Now I am inside, you see, in the esophagus area. I already made a dissection of the diverticulum, which is nice, right? You can see very well my blue, correct? So I think I think it was very great to show you this tip. It doesn't happen too much to me, but when it happens, I do this technique, the Alberto Batista technique. Hmm? You can see very well. So now I will dissect a little bit more, just few centimeters more. A little bit more. And then we will cut the muscle, and that's all, okay? So we almost finish. Very good. You see? A little bit more. 1 centimeter more. Very good. Okay, so very good. Okay, now I think I'm fine here. So then I will start to cut the muscle, okay? You can see very well the tunnel. It looks like it was very big, right? But it was not that big. It was just 2 centimeter more. And very sticky. Now I will start to cut. I am cutting the muscle now. You see? Very thick muscle. Hmm? Very thick. Very good. You see? I'm still cutting, but it's very thick, huh? The muscle is very thick. So I think this is the limit. Hmm? Yes, I am 19. Okay, so I saw, if you saw it, it was a bleeding because of the muscle. Muscle have a lot of vessels, right? So in these cases, I like to use also spray coagulation because you can make the spray and the bleeding is stopping. I didn't change any other, you know, I didn't use any other device, right? Like a coagulosper or something like that, because I believe it's a nice setting. Many other physicians like to use precise quack, but to me, I think I go faster just with the spray coagulation. Almost here. Very good. This is 20, yes. So I believe we are done. Now it's perfect. You see? Now it's completely open. And I finish, I believe, a little bit more, maybe. So, Dr. Alcivar, what do you think? Is okay? So, Dr. Alcivar said it's okay. So, one is saying this is okay. So, he says it's okay, so it's okay. A little bit more. Very good. Now it's perfect, huh? So let's see outside. How is this going? I think it's nice. Hmm? I think it's very nice. So now I will just close this. This is the septum. Which I believe the concept of open, to let this open is just to avoid this kind of, uh, so this is, so now we're close. There's not much, there's not muscle more here, okay? Nano clip. No, the 11. So, open, abre. Ahora bien. Cierra. 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 So now I put my first clip. It's a small clip, you see. The my incision was not so big, so which is good. Other clip. Which is really good. I believe 1 or 2 more clips will be enough. So the most difficult technique for me has been the C poem, the cricopharyngeal poem. Very difficult. But we had just one case, and it was good. Abre. Very good. No te muevas. Cierra. Cierra todo. I think it's good, So one more clip. And we finish, okay? Small emphysema is okay, Don't worry about that. It is very important to use CO2, right? Ok, gira y abre. Abre. Gíralo. Así, ahí está perfecto. So, I think I am very, very well now. Cierra. Cierra todo. So, you see, it's perfect now. So, it's passing very well. Now I'm in the stomach. I will remove the air. So I finish. Thank you so much. I think we learned a little bit about Z poem, right? For Senker diverticulum. I still in depth with you regarding the Moen's technique, the open Z poem. So maybe I will bring my friend here to teach me a little bit about that. We were discussing a little bit during ESG days in Barcelona, but I think it's super nice to discuss with the people in charge of that. So let's see how this patient goes. I think we finished. Thank you so much. We will see next.